Okay.
Yes, we can hear you. I'll get this webinar started. For those of you who don't know me, my name is Warren Geigo. I'll be facilitating this monthly webinar. It'll be the second presentation, and I would like it if those of you who are online, could you kind of introduce yourselves real quick so we know who's all on the presentation on video.
Should we introduce ourselves, Warren, or did you want us to wait until
it's done? So you just snap it out in those 5 minutes, so you know exactly what you're going to say about this. So then we can just go on.
Yeah, if you introduce yourselves, that'd be great. Actually, we'll just get going with NPTEC's presentation. Having a little difficulties here. Let me introduce them first. We have PJ Beaudry, who is the director of the Northern Plains Tribal Epidemiology Center. He completed his undergraduate degree at Boston University with a BA in health science and his MPH at Columbia University's Mailman School of Public Health with a concentration in health and human rights. He currently serves as the director of the Northern Plains NPTEC and of GPTCHB Sexually Transmitted Infections and Teen Pregnancy Prevention Program. In addition to his MPH, he has been certified in public health by the National Board of Public Health Examiners. And we also have Amy Muchna. She's an evaluation coordinator for NPTEC. She has a BS in physiology from the University of Arizona College of Medicine, and she's continued her studies at the University of Arizona, where she completed her MPH with an emphasis in global maternal and child health. She's currently working as NPTEC's evaluation coordinator. She provides technical assistance to tribes in the Great Plains area and the topics of evaluation and data collection. And to just kind of go over what they'll be presenting on, NPTEC provides leadership, technical assistance, support, and advocacy for the 18 tribal nations and communities serviced by the Great Plains Area IHS. Their presentation gives a brief history of the tribal epidemiology centers and their position within the national public health systems, then discusses some of their current projects in chronic disease, maternal and child health and trauma, CDC's Good Health and Wellness in Indian Country Initiative, and Diabetes Data Quality Project. And we hope, by the end of the presentation, to have communicated an overview of their overall objectives and current projects in a way that provides examples of the services that they provide for their tribal partners. And with that, Amy and PJ, could you share your screen, your presentation with the rest of the viewers?
All right. Warren, can you hear us all right?
Yeah, I can hear you.
Okay.
So like Warren said, my name is PJ Beaudry. I'm the NPTEC director, and this is Amy.
Hi.
She's the evaluation coordinator for NPTEC, and like Warren said, we're going to try to go through a little bit of just a background of the Epicenter, kind of our place in the big picture, I guess, and then Amy will take you through some examples of how some of our work has applied to community health and some of the activities that the Community Health Department here at GPTCHB has been working on, including Great Plains Good Health and Wellness and some of the other projects. So do I just hit arrow keys like standard to advance this, or fair enough?
Maybe.
Or not? There we go. All right, so hopefully you guys are seeing our slides progress here, but so something that Dr. Jennifer Giroux, who is the medical epidemiologist here at the NPTEC, has really taught us over the past couple of years is, as the American public health system was set up in the United States, it was really set up primarily with these kind of federal, state, and local sort of branches, as you can see, with the federal, of course, being the CDC, which is generally considered to be kind of the public health institute for the United States, coordinating, public health efforts at a national level. and then they coordinate with state epidemiologists and local epidemiologists that are part of the public health system. Yeah. So what is kind of absent clearly in this picture is tribal public health, and really that's where the epicenters sort of come in, is to add that fourth leg of tribal public health in partnership, of course, with tribal health departments and tribal public health infrastructures that exist, you know, in a variety of forms across the Great Plains area. So that's kind of our biggest role, is to sort of help fill in some of that public health system, along with the IHS and along with you know, our tribal partners and tribal health departments. So we'll go into a little bit of how that works now. But just so you guys are kind of aware, public health surveillance is really what, you know, one of the key factors that NPTEC works on. And essentially, this is a pretty good overview of the worldview of public health surveillance that was put together by our chief epidemiologist here at the Epicenter, Dr. Corey Smith. What you can really see essentially within public health surveillance, and that could be infectious disease surveillance, it could be conducting standard public health assessments like the Behavioral Risk Factor Surveillance System, or BRFIS, that some of you might have heard of, things like that. You know, we see that the data comes in, we spend some time analyzing that data, summarizing results, and then disseminating it out. And that takes the form of information, which is then interpreted and to become knowledge and action at the, in this case, at the tribal level, at the state level, all kinds of things like that, in terms of formulating new hypotheses for future research, developing policies, establishing programs, all kinds of things like that. And in a very large part, this is really the sort of process that Great Plains Good Health and Wellness went through in its first year, in terms of you know, conducting community assessments or taking existing community assessments and turning that into action and policy and things like that, which is kind of the step that we're at now, of course, as I'm sure a lot of you guys know, perhaps even better than I do. Really, within that public health system, at first, IHS actually had area medical epidemiologists at every IHS area office. And there was some reform that was happening to phase out those area epidemiologists. And as a result of that, you know, recognizing that sort of public health vacuum that might have been created as a result of that phase out on the part of IHS, as they kind of retooled to focus more on medical care and patient care, a group of CDC Intelligence Service alumni who were working for IHS started to allocate some funds for tribal epidemiology centers from existing IHS funding, and really laid the groundwork for the epicenters and what we do through by putting language into the Indian Healthcare Improvement Act, which, as some of you may know, was reauthorized as a part of the 2010 Affordable Care Act. And really how that kind of played out here in the Great Plains is we had Tom Welty, was the Great Plains area medical epidemiologist, one of the last to retire, and you know, just initiated some incredible projects here in the Great Plains: an infant mortality study, the Strong Heart study, hepatitis A vaccination trial, the SUD cancer study, all kinds of things like that were sort of initiated under his direction. So definitely, you know, kind of gave us some big shoes to fill as the tribal epicenter. But the new direction, of course, that we took, that IHS took in terms of public health, was towards tribal epidemiology centers. So in 1996, 4 TECs were established through core funding from cooperative agreements established with the Indian Health Services Division of Epidemiology and Disease Prevention. And that's still how the epicenters are funded to this day, with some additional funding sources, as you guys know, in terms of good health and wellness and things like that. And the epicenters really take an IHS area focus. So each area has is associated with an epidemiology center that works to on a variety of services for that IHS area. So of course, ours being North Dakota, South Dakota, Iowa, and Nebraska, as you'll see in a second. And the IHS area office was directed to provide technical assistance to the epicenters by placing an epidemiologist with each tribal epicenter. So by 2008, those 4 original TECs had been expanded to 12 tribal epicenters that served all IHS regions and American Indian Alaska Native urban centers nationwide. So those 11 TECs and the Urban Indian Health Institute function independently, but we work together to advance common goals. And the location and sort of housing or basis is unique to each TEC, you know, where they could be based at intertribal health boards with individual tribes, with or sort of established as corporations. But like we said, we all kind of work together to advance common goals. And actually, Amy and I will be going to meet with the other tribal epicenter directors in a week or so to really facilitate that process, as we do every year. So this is kind of a map of the tribal epicenters. So as you can see, obviously, definitely in line with the IHS regions. The only exception for those of you that are a little bit more in tune with the IHS regional system is the Intertribal Council of Arizona also covers the Tucson area IHS, which is kind of the only distinction between the two here. But you can see, like we said, us at the Northern Plains Epicenter are based in Rapid City, South Dakota, and you can see that we work on those 4 purple states, North Dakota, South Dakota, Nebraska, and Iowa. And in those states, of course, we work with 17 partner tribes and 1 service area. In terms of the tribal epicenters, our mission is to improve the health status of American Indians, Alaska Natives by identification and understanding of health risks and inequities, strengthening public health capacity, and assisting in disease prevention and control. And really, to operationalize that mission, really the TECs serve to contribute to 7 core functions, which come down to a variety of different services, as you can see, in terms of collecting data, evaluating data and programs, providing disease surveillance data to tribes. We already talked about that. Providing epi-technical assistance to tribes and tribal organizations, making recommendations for health service needs and care delivery systems, etc. And definitely one of the most important ones, identifying health priorities with our tribes and then working to accomplish all of these functions in line with those health priorities. So definitely some key core functions that are good to stick in your brain. And along the same lines, we sort of use the 10 essential services of public health to really frame some of the activities that we work on. So with a couple exceptions that aren't really within our wheelhouse, we attempt to cover all 10 of these public health services in some way, shape, or form. So you'll probably recognize that there's a lot of overlap between those 7 core functions and the 10 essentials of public health. So definitely very important. And hopefully some of you actually have posters with these 10 essential services all spelled out on them that we produce. Definitely want to promote those 10 essential services and have everybody within public health keeping those in mind as they're doing their day-to-day work. So in terms of the Northern Plains Tribal Epicenter specifically, our mission is to provide leadership, technical assistance, support, and advocacy to Northern Plains tribal nations and communities in order to eliminate the disparities in health that currently exist for tribal people within the area. And within that, our role is to provide technical assistance with or coordinate public health surveillance activities and program evaluation, as I mentioned, to house and manage tribal data, disseminating timely, accurate, and useful reports on a variety of topics, and consulting with tribal programs and staff here at the Health Board regarding data management, and to conduct or assist with projects related to a particular emergent public health priorities or issues of interest to our partner tribes. And really, that's just a summary. You know, I think our work plan currently is running at about 130 pages long, considering all the different activities that we do and things like that. So chances are we're touching on it if it's an interest of yours or of your programs. Our goals are really and I apologize, this slide might be a little bit small, but our primary goals are to provide Great Plains area tribes with reports of timely, accurate, and useful data on public health priorities based on existing data sources, and really to contribute to the effective use of these data in accordance with public health ethics. We also seek to improve the ability of surveillance systems to measure and monitor the health status of American Indian populations through the effective utilization of existing tracking or surveillance systems or the development of new surveillance activities when new activities need to be developed, which is often the case, you know, tailoring some of those surveillance systems to our tribal communities and making sure that they're producing meaningful data for our tribes is very important. Supporting evidence-based, culturally rooted health promotion and disease prevention initiatives in clinical and community context. And of course, that's really a lot of what we've been doing with good health and wellness programming is supporting those types of programs and setting those things up. Building capacity to conduct health research, and building and leveraging effective partnerships and responding to emergent needs with training and technical assistance to contribute to the growth of public health capacity within the Great Plains area. So definitely, a pretty good summary of what we're hoping to accomplish here at the Epicenter and what our activities are sort of working towards. So in terms of an overview, and I won't spend too long kind of talking about this, but Epi does a lot of different projects, and they fall into kind of these three big overviews that we've sort of already talked about. So you can see that we work in a variety of different areas in terms of outbreak management, providing chronic disease or risk factor data through the BRFIS, maternal and child health data with the PRAM. MVP is our vaccination project that we've been working on for adults. We do a wide variety of assessments and different kinds of projects in terms of the Good Health and Wellness MSPI, DVPI initiative, CAP, housing and managing tribal data, and then translating that data down to the tribal level through mortality reports, different specific or cause-specific mortality inquiries, collaborating with state health departments, and producing CHPs for our partner tribes. And conducting or assisting with projects related to particular areas of interest. So, of course, recent areas of emerging priority has been drug use during pregnancy, substance abuse, behavioral health, maternal and child health, being kind of the biggest priority that we've been working on in the past couple of years. But, of course, also recent outbreaks of infectious disease, and a very long-term priority of ours has been chronic disease and addressing some of the chronic disease mortality disparities that we've seen in the area. So just a wide variety of activities that we've tended to work on. And I think that's going to take us right up to Amy kind of describing a little bit specifically what we've been working on related to community health and Great Plains good health and wellness and things like that. And how are we tracking questions here? I don't know if it's like a chat function or if people can speak on the line, but please feel free to let us know if you have any questions or anything like that.
Yeah, PJ, at the end of the presentation, they'll be able to ask questions. So.
Sounds good.
Perfect. Yes, we like to say that public health data is only as good as what you use it for. You can collect it, but the point of it is to use it to attack different problems or to address different issues. So here's just kind of a brief overview of some of the things that we're doing. We're looking at addressing trauma as an upstream cause of many issues in the communities in the area and throughout the country, also chronic disease. So as PJ mentioned, looking at maternal and child health, behavioral health, and substance abuse issues. And these issues were really first suggested by tribal leadership back in 2012. So the leaders together decided that this was a direction that they wanted the Epicenter to focus on based off of all of the data and what they were seeing in their own communities. And so really the approach that we've taken has been to spread awareness of resilience as a tool to address historical trauma, adverse childhood experiences, and toxic stress. And I'll go into that just a little bit later in the next slide. And really accessing information, best practices, and subject matter expertise to contribute to helping to prevent and to address these issues. Also, we provide technical assistance to the Good Health and Wellness and Indian Country grantees, and we're tracking area-level impacts of the program. So our role as a tech is kind of hopefully have kind of a big picture view of what the initiative looks like throughout the entire area so that we can, across the country, see kind of what are the biggest changes that have been made and what are some changes that can be implemented at area level and national level. Also, we've been contributing to enhancing the quality of diabetes data with a couple of different projects that we'll talk about later. And then we've been partnering with the programs across the health board here to address chronic disease, really by, again, providing technical assistance, data services, and systems connections in whatever way possible. Feel free to add in if you want to.
No, good.
So that first thing that we talked about, maternal child health and trauma, our approach to addressing those issues, which were given to us, those priorities which were given to us by tribal leadership, is through our Balanced Parents for a Balanced Family campaign, I would say. So what we're doing is we're giving a presentation. Really, the target audience is pregnant women, but also women who may become pregnant and other caregivers, their partners, the whole family, behavioral health and maternal child health, social work practitioners, all these folks that are involved with this type of substance abuse problems, community leaders, and others. So we really want to reach a wide target audience, as wide as possible. The folks that deal with substance abuse and behavioral health and new moms. And really what this presentation does is it describes kind of a combined impact of a few different types of trauma: historical trauma, adverse childhood experiences, and toxic stress. And it emphasizes the importance of resilience as a tremendous yet natural tool to overcome these impacts. And so we like to really emphasize how strong resilience is within the communities, that the communities are seeing these issues, but they're also very resilient. And so that's what we like to talk about with this presentation and through this campaign, kind of an educational campaign. And really what we've seen with the trauma work, through subject matter experts that we've collaborated with and through our own research, we've seen that trauma early in life really can lead to even chronic disease issues later in life. And so that's what the research shows. And so by giving this presentation, we are targeting right now substance abuse in mothers, and in pregnant women, but also looking at the downstream effects also include, other types of chronic disease, behavioral issues, things like that.
And if I can add before we move on, Amy, we've actually given this presentation in 16 of the 18 communities that we work with so far, and we have plans to go to the other 2 to give it. And just the response has been overwhelmingly positive. And of course, we're not subject matter experts on these topics necessarily, but definitely just wanted to get that conversation started. And it's really kind of tipped the the ball rolling, or the snowball down the hill. In terms of addressing trauma as a factor. And we're very lucky to work with the behavioral health departments and the maternal and child health department here at the health board to really support our work in those areas and keep that snowball rolling. So definitely keep your ear to the ground for exciting opportunities related to that if that's an area that you're interested in moving forward. Definitely something that we're not planning on not continuing to promote. And that presentation is available if again, if folks are interested in that topic, we can definitely share that presentation.
So, just to kind of quickly look kind of more visually at how we arrived at this trauma as being the upstream cause for a lot of issues. Really, this pyramid graphic here is from the Adverse Childhood Experiences Study website, and really what it describes is how with all these traumas at the base, adverse childhood experiences and other traumas like historical trauma and toxic stress, which causes disrupted neurodevelopment, we kind of walk our way up the pyramid here and see that those things lead to social, emotional, and cognitive impairment, and ultimately adoption of higher risk behaviors, which can result in more disease, disability, and social problems, and ultimately early death. And so when the Epicenter was given this kind of as a tribal priority, what laid the foundation for that was the fact that they were seeing a lot of early deaths. And so they kind of worked backwards from this, using subject matter expert and research, worked backwards from this idea of early death and kind of tracked backwards down this pyramid here to find these traumas at the base, really being, they lay the foundation for trouble later on. And so if you can attack here at the base or address issues here at the base and look at trauma and look at child development, that really has a lifetime influence and impact on people. And so even in reducing not only behavioral health issues, but also chronic disease issues.
And of course, the most visible parts of this pyramid tend to be those top 3, wedges in terms of those early death, social issues, disease, disability, and those risky behaviors, which is where we're talking about, some of our, death due to car accidents and, substance abuse and all kinds of things like that. So that tends to be, what the most visible elements of this are. And, we feel strongly that we've kind of finally drilled down to that source, and that's why we're really trying to promote some of that response, because if we can mitigate those adult adverse childhood experiences and toxic stress and things like that, then in the next 7 generations, we might have trauma-free generations, and we will hopefully start to see some of those disparities starting to narrow.
So moving on, just to talk, oh, never mind, I forgot, we have one more slide on this one. So just looking at, this is basically a summary slide of what PJ and I were just saying, but looking at how these combined approaches of behavioral and public health can really improve the well-being of individuals into the future. So it's a long-term thing. We're not going to see changes right away. Nobody is, but it's something that we can at least recognize and start implementing in our own, even in our own families and our own organizations, and then kind of move forward from there.
And it's something that, to be honest, I think is really in keeping with the PSE type model that Good Health and Wellness emphasizes, where it can't just be the individual that sort of overcomes their traumas and things like that. It's definitely about creating trauma-free communities and, supportive families and everything like that, and policies that support trauma-informed environments and things like that, that really is what's required to make, these type of impacts. So, again, definitely something that we've been working on, and that's been very heavily influenced by that PSE concept for us.
And then again, we're not experts on, but would love to discuss it with anyone further. Just to look quickly at our role in Good Health and Wellness, like I said earlier, we do provide technical assistance directly to a couple grantees, to the Component 1 grantees, but then we're also supposed to be providing technical assistance to Component 2, which is our Great Plains Good Health and Wellness team here, Eugene and Warren, and also their sub-awardees. So really, anyone involved with the grant, we're here, we're available for technical assistance. And then also, as far as evaluation goes and performance measures, we're looking at area level alignment. So hopefully getting kind of a bigger picture view of the whole area and all the different projects that are going on. It's our job as a tech to really highlight the really great things that everyone's doing and to report that back. So to kind of have a summary of all the wonderful programs that are going on, and then have that larger picture area level view to then report nationally. So recent and upcoming activities. We've done some trainings here. We did training on the PSE tool, focus group analyses, the diabetes audit, and GIPRA IPC trainings. Those were all kind of throughout last summer and last spring. And we do have some additional trainings coming up, hopefully, as soon as the logistics get figured out, and that we can send that out on listserv as well. Organizing or contributing to meetings and supportive systems connections. So really looking for ways to facilitate systems connections as much as possible. And then also trying to provide leadership for and technical assistance with the translation of the diabetes audit data. So looking at ways to take diabetes audit data and other diabetes data specifically, but chronic disease data, to look at how we can translate that in a way that is really actually more approachable and really useful for the community, so that they can kind of have something in hand to say, this is what diabetes looks like in my community, and kind of move forward from there as far as prioritizing and things like that. More information will be coming on that. And then kind of lastly, we're working on diabetes data quality projects. So it's supported with funds from SDPI, but NPTEC's going to provide some technical assistance and training to staff and partners, really to discuss and promote awareness of how important data input is at kind of that clinic level, and then how it can be used for clinical quality measurement, and how it's used kind of from the big picture as well. You want to talk a little bit more about this?
Yeah, so I mean, essentially what we're hoping, of course, some of the national data systems that we as an Epicenter engage with are becoming more and more utilized to inform, prioritizing and decision making and things like that. So like we said, just really promoting that concept of data quality, and that every person at the ITU level contributes to data quality in some way, shape, or form. So really, you know, we're hoping to use this project to highlight the link between clinical care, kind of coding and billing, and community health, and to sort of, again, emphasize that importance of everybody plays a role in data quality, and not just in data quality, but also in community health and things like that. And again, you know, definitely just very interested in promoting that concept of community clinical linkages and, you know, sharing responsibility for community health between, you know, community programs and the clinic and the individual and the policy makers and everything like that. So as with the diabetes audit translation, you know, a lot of those projects are sort of still developing. So, you know, we'll be kind of sending more information out about those as that information becomes more solidified and available. But definitely excited to be kind of getting into this and building some of this stuff for the future in the next few months. So keep an eye out for that if diabetes is your area.
And I think that's it. We have some time for questions, I believe. And I might have seen a question pop up, but I don't know how to get to it. Here we go. Or I saw a chat pop up. Okay, that's perfect. Yeah, so anybody, if you have any questions, please feel free to ask, or you can always contact us. We'll give out our contact information. Again, we're just looking at, we just wanted to share this presentation with all of you just to discuss our role, just to kind of communicate with everyone what we do and kind of projects we're excited about for the future now, and ways that we can hopefully make data accessible and useful to all of you and all of your programs, projects, grants, things like that. So any questions, let us know.
And if we can go back to any slides, if we kind of jump through them too quick or anything like that, we can definitely do that too. Just keep us posted, whatever we can do to help.
PJ, we're going to have to cut it short a little bit. If anyone has any questions, feel free to email, you know, PJ, Amy. And I'd like to appreciate everyone who attended the webinar. Next month, we'll be having another one on April 13th on tobacco control with Teresa Stites. She's our tobacco control coordinator here at Great Plains Tribal Chair and Health Board. And we look forward to everyone who attended, and to encourage you to come to our next webinar. And I'd like to thank Amy and PJ for their expertise in their field, and I hope you all have a good evening. Thank you.